So now we are going to look at the difference between empathy and compassion. And we're going to look at it from a neuroscience perspective, and we're going to look at it from an IFS perspective, and we're going to look at it from the way we are to be with someone, the way we sit with someone when we are helping them heal. And some of the research based on this empathy and compassion discussion comes from the work of Tanya Singer. She is a neuroscientist from the Max Planck Institute in Germany, and she's done some really incredible work from my perspective on the difference between empathy and compassion. Dick Schwartz and I met her at a World Summit, several years ago now up in Iceland. And I got really excited about the work that she was doing. She's got an ebook on empathy, and she talks a lot about empathy and compassion. And she got, in turn, really excited about IFS. And she's done what's called the Resource Project, which has three main different dimensions looking at helping people develop compassion, develop empathy, and develop the capacity to step outside of themselves to see someone else's perspective. That's called theory of mind, and we talked about that in the last section when we looked at resilience, right? The capacity for someone to step outside of themselves and see someone else's perspective. Interestingly enough, she had a meditation section, she had a compassion section, and she had that theory of mind section, stepping outside of oneself to see someone else's perspective. And that last section, which was based on IFS, showed the most success in helping people change and grow in relation to that experience. So mindfulness showed very little change, just mindfulness meditation. Helping people cultivate compassion was helpful for them in the quality of their lives and overcoming mental health issues. And the biggest thing, which was surprising to her and to me, was the capacity to step outside of oneself to see someone else's perspective had the most benefits in overall health and well-being. That's the Resource Project for those of you that are interested in learning more about Tanya Singer's work. Here we're going to look at the difference between empathy and compassion. And what Tanya's research showed was this. She mapped out the neural networks of empathy and compassion. That's a lot of what's happening in the field of neuroscience right now, is mapping out networks. We'll talk later about the networks of emotion, which I mentioned, and we're going to talk right now about the networks of empathy and the networks of compassion. For me, it's how you're with somebody that matters, okay? And different states really require different ways to be with somebody. Compassion, as defined by Tanya, is a feeling of concern for others' suffering with the motivation to help them. And it involves the care-seeking network. The care-seeking network, as you can see in the slides, the ventral striatum, the pregenular anterior cingulate cortex, and the medial orbital prefrontal cortex. You don't have to say those structures 5 times fast. I can hardly even say them. Anyways, those are the structures related to compassion. And it's related to the seeking network, which is connected to dopamine, interestingly enough. So when you look at addictions, when you look at care and seeking, it's connected to the dopamine system. A lot of emotions have neurotransmitters and chemicals associated with them. When we look at compassion, it's a care and concern for someone else's suffering with the desire to help them, the motivation to help them. That's where the dopamine comes in. That is an unblended state in IFS. And what I mean by unblended is it's separated. It's self separate from parts. Remember the meditation that we did around having parts relax and having self-energy emerge? Compassion is connected to self-energy, and it requires parts to relax or unblend or separate so that we can be with either our own parts, unblended, or we can hold space and be with our clients' parts, or be with our partner's parts, or our children's parts, right? It's the capacity to feel concern for someone, but to hold space It's not blended. We're not feeling a lot. We're holding space for someone else. Very aligned with self-energy. Empathy, on the other hand, is a resonating with somebody else's suffering. And this is interesting, this idea of resonating with somebody else's suffering. Different people have different views about this. I just posted something on social media about mirror neurons and resonating, and it got a flurry of activity. Tanya Singer's view of resonating is not connected to motor neurons. It's connected to empathy, which I'll describe in a moment. Motor neurons, according to Tanya Singer, is mimicking motor movements, not touchy-feely therapist stuff. And it really triggered people when I said that. So motor neurons, right? If a monkey raises his hand, another monkey raises his hand. That's resonating through motor neuron, according to Tanya Singer. Now, other people talk about resonating, like I'm feeling your feelings, I'm with you. Tanya Singer sees resonating with somebody else's suffering as empathy, and it's connected to the insula and the mid-cingulate cortex, the anterior portion of the insula and the anterior mid-cingulate cortex. It's interoceptive. It's an embodied sense of feeling someone else's pain, okay? And that we can burn out in empathy. There's such a thing, according to her research, as empathic distress, but there really isn't such a thing as compassion fatigue. We can hold compassion for a really long time. We get burnt out in empathy. Now, when I look at this a little bit deeper, and I talked to Tanya about this a little bit deeper, is that it's a blended state. That it's not really, I'm feeling your feelings. It's, I'm feeling my feelings while you're feeling your feelings. So when we tear up when we're with a client, we're not tearing up for them. We're tearing up because our wounds have been activated. It's like, I start feeling it, and then I start tearing up while my client is feeling it, tearing up. It's a difference, right? It's not the I'm feeling yours, it's I'm feeling mine. In IFS terms, this is blended. So we're in our parts when we're empathically resonating. And we're in self-energy when we're in compassion. Very important distinction. Now, one of the things I want to say about this is one is not better than the other. We need both empathy and compassion as it relates to healing. I can tell you personally, for me, my parts sometimes need me to feel what they're feeling so that I can truly get it. And my parts want somebody to be there with them, that they don't want me to just totally slip into their experience. So this combination of empathy and compassion is very important. Most therapists are kind of more comfortable at one versus the other. Oh, I'm much more of a touchy-feely person. Empathy's easier for me. Or I can hold space for anybody. I can tolerate a lot of affect. I can hold space. Well, guess what, folks? It turns out that many trauma survivors need both. They need a combination of us holding space for them, and at times they need us to feel what they're feeling to truly get it. You know, your clients have said, they've certainly said this to me, you don't get it, your life is so perfect, how do you know what it's like to be me? What they're saying there really is, I need you to empathically resonate with me. Okay, so we need to be flexible between empathy and compassion, depending on which parts of our clients need which things at which point in time. I'll tell you a personal story right now. It was a time, several years ago now, my son had a really bad accident. He was in the hospital. I was totally freaked out. So I'm at the hospital with him, and they're like, it's visiting hours are over, you have to go home. I was feeling desperate. I didn't want to go home. I wanted to be there for him. I didn't want him to feel alone. And he felt my desperation. He's like, Papa, it's okay, go home. Papa, go home. I'm like, no, honey, I'll be here with you. What I didn't realize at the time, but realized shortly thereafter, is I was overwhelmed and I didn't want him to be alone. I think he felt my overwhelm and he was kind of putting up some boundaries, even though he would have wanted me to be there. He didn't want my overwhelm to be there. Okay? And I drove home. I was driving home, and Dick Schwartz, in his loving way, called me while I was driving home. He's like, how's it going, Frank? I burst into tears. I'm crying on the highway. I'm like, oh my God, I can't believe this is happening. I was just like so overwhelmed, as parents are when their kids are hurting. Dick Schwartz says to me, pull over. I'm like, what? He's like, pull over to the side of the road. So here I am on like 495 on the highway. I pull over on the side of the road. He's like, let's do some work. What the hell are you talking about? Let's do some work. Let's work with the part of you that's overwhelmed and distressed about your son. Excuse me, I wanted to flip him off right there. What do you mean? Work with the part of me that's overwhelmed by my son. I'm a parent. My kid's hurting. I'm overwhelmed. Don't you get it, you idiot? Like, I was so incensed in that moment, right? Lo and behold, I'm like, okay, fine, Dick. He does some work with me while I'm on the highway. This is such a sign of who Dick Schwartz is, really. And I couldn't believe it. I got in touch with a part of me that was totally overwhelmed, that was about my history, that was my young attachment wound being totally freaked out for being alone. He was absolutely right, and I didn't know it in the moment because I was so overwhelmed by my part of fearing being alone, of remember being alone. My exile or my wounded part got activated, and I was blended in too much empathy with my own part, and my son felt it. That's why he said, go home, go home, go home. Well, Dick and I did a healing session on the side of the road, and the next day I came back to visit my son, and I was in a different space. It's like, honey, I'm really sorry. I think I was really overwhelmed yesterday. I know that you need me. I'll be here in the way that you want me to be here. And I'm really sorry if I was too overwhelmed. I know what it's like to be alone, but I don't know what your experience of being in the hospital by yourself was. I wish I would have asked you instead of pushing myself on staying. The whole demeanor changed. Like, he totally got it. He's like, thank you, Papa. I love you. I'm okay. Yes, it was really scary for me to be alone too. So it was a joining of the two of us. But after I did the work of healing the part of me that was so overwhelmed of being alone when I was younger, which got in the way of me being able to be there for my son in the way that he was feeling being alone. So empathy is important, but if it's too much, it can be overwhelming. Compassion is also important, but if we only hold compassion without empathy, sometimes people can feel we're too distant from them. Okay, so then when somebody is activated, let me say that again so make sure that you get that clear. Empathy is very important. Parts need us to feel it. But when we're too much in our own experience, it can feel overwhelming to someone because it's more about us and our histories than it is about them. Compassion, on the other hand, is really useful, but if it's too much compassion without empathy, without that resonating or connecting in an appropriate amount, it can feel distancing. Like, where are you? I've had clients say, like, you don't get me. You're not really feeling it. Too much compassion, not enough empathy. We're constantly needing this combination. What neuroscience shares with us is when somebody is sympathetically activated in that fight or flight state, compassion is more useful. We hold the space for somebody when they're sympathetically activated. If we join them in their feelings, it's too much energy. Energy gets energy. It's like, I'm freaking out. Yes, so am I. Not helpful. Okay, so when somebody's sympathetically activated, compassion's a better stance. When somebody is shut down, dissociated, numb, and disconnected, empathy is more useful. We're wanting to try to connect with them. They have protective parts that are shutting them down. We want to try to empathically resonate so we can help them connect to the feelings that parts of them are shutting down. So when somebody's activated, compassion is a better position. When somebody's shut down or dissociated, empathy tends to be better. And when wounds are present, usually a combination of empathy and compassion is the best combination. So I'm going to encourage you to play around with this a little bit, to get some flexibility within yourself between empathy and compassion, because you have both. We all have both. But when do we use which one? Super important for us to pay attention to. One of the things that I do in between each one of my clients, and this is what I call like an in-between session meditation. I'll have somebody leave and end the session. I check in with myself. Thank goodness for the 50-minute hour, right? We have a little time to go pee, take some walnuts, almonds, whatever you eat in between sessions, and do a little meditation. And what I tend to do is this. I look and sense, what am I feeling? Am I carrying anything emotionally from my previous client? Is there any energy that they activated within me? What am I carrying with my previous client? I'll validate that. I'll acknowledge it. Oftentimes it's useful information because I wasn't conscious of it. We're picking it up. I validate it. Sometimes I'll even take notes and write it down. And then I clear that energy. I ask that energy to leave, and I send my previous client some compassion. Clear my energy, send my previous client compassion. Then I'll check in again and say, okay, I'm meeting with my next client. What am I feeling towards them? Is anything being activated with me in anticipation of seeing the next client? I'll ask that to separate. I'll send love and compassion to my next client. I set up a boundary from what I felt for my previous client, and then I used to say, I'll go out into the waiting room and get my next client. Now I say, I'll shut the Zoom off and turn the Zoom on, and I'll see my next client, right? It's the same thing. Clear the energy, release it, open up energy for your next client, and then move forward. Now, I want to mention one other thing here before we move into a little experiential exercise. And what I want to mention is this. We also have the capacity to pick up somebody else's feelings without feeling our own. Like sometimes I'll walk into a room, and this is what I think the layperson calls an empath. I'll walk into a room and I say, wow, so-and-so is really having a bad day. Now, I'm not triggered, I'm not activated, I'm not feeling anything, but I can pick up somebody else's feelings. And I think that's something different. I mean, I can hold space for them, I could be in compassion, but I can pick up somebody else's feelings also, which is something slightly different.